before I had the eustachian tube surgery, um, traveling on a plane was very difficult for me. I was traveling maybe once or twice a month on a flight, and especially on the descent, I would feel my ears clogging up, and it wouldn't go away. It would get worse, and even after landing, it wouldn't clear out, and the fluid would pool in my ears, and I'd get an infection, and it would take 2 weeks of antibiotics at least to clear it. It's very uncomfortable. I lose my voice a lot of the time. Even traveling on an elevator could be a problem for me. I was just miserable, constantly miserable. Well, I think the final last straw was a red-eye flight I took from California back to New York, and I remember waking up in the middle seat, feeling my throat closing up and my ears closing up, and I realized I was only halfway to New York, and I had a panic attack. I had a vicious panic attack, and I got off the plane that day with my ears just absolutely rumbling. I went back to my office and I did some research and looked for cutting-edge physicians who could possibly help me with this problem. I knew I wasn't getting drainage from my sinuses and didn't know quite what to do, but through that I found Dr. Liberatore. So basically, I came to Dr. Liberatore's office, and she examined me, had a CAT scan done, and afterwards she advised me that my eustachian tubes were completely shut down. And she mentioned that this was a possibility that was being done, and I jumped at the chance. I was her very first patient. The surgery was scheduled for a few weeks down the road after our consultation. I came into the surgery first thing in the morning, and very relaxed situation. Met with Dr. Liberatore before the surgery, and I think I was out of the surgery and back on the street, going back to my apartment by maybe 11:45 or something like that. I went back to my apartment that afternoon and relaxed. I actually did some work from my apartment, on the internet. Did work, and the next day I worked, and that was a Thursday and Friday, I think, and by Monday I was back 100% full speed. It never slowed me down. I didn't feel any pain that I can remember. It was really very, very, in terms of surgeries, very benign. Well, there's a major difference in my life from before and after. And the difference, it didn't cure me per se. I mean, I get on a plane, I still spray my nose when I get on the plane, and I put my pressurized earplugs in because I'm scared of getting that pressure build up. And my ears still clog up sometimes, but the nice thing is that without fail, since I've had the surgery, my ears pop and they clear out, and I haven't had an ear infection since then, which is just a tremendous change in lifestyle. This past summer I flew probably at least a half a dozen times, if not more, and I was able to do it without getting sick. And that's something that I just couldn't do before. I think this is a very worthwhile type of procedure to consider. It dramatically enhanced my life, and I think that if you suffer from the same types of things that I suffered from, it's a no-brainer.